Welcome to the show. We are live. Welcome to We Do Better News. We're coming to you live from Austin, Texas. I am your host today. My name is Rick Rifkin. We Do Better News is brought to you by We Do Better. We're a grassroots organization, and we're committed to the organizations and companies here in the United States that are doing a better job. And we've got this show just so that we can highlight the organizations that are doing better. And today we've got fantastic stories. We have a story about clean water coming to people in need in the United States, about companies doing a better job recycling, and a lemonade story. I'll tell you a little bit about that later. We have a special guest as well. Kristin Karas from Dance Safe is going to be educating us on drug checking. And then I'll be talking a little bit about an article from Topher Spiro. So this just in from the Good News Network. 2 teenage girls raised money for clean water. They run an organization called Paper for Water. It's 2 sisters in Dallas, Texas. And they've raised in the last few years $1.5 million for clean water initiatives here in the United States. And they decided to clean up with the nonprofit called Dig Deep. And Dig Deep operates in the desert areas of Utah, New Mexico, Arizona, and they specialize in helping Native American communities. And so the Teen Sisters Initiative raised about $150,000. And the way they raised that, and I'll show you a picture again, was that they make origami pieces and they sell them, and those proceeds go back to fund their projects. And they run, weekly, bi-weekly workshops where they actually make origami with volunteers. And so Dig Deep has created a project on the Navajo Nation, which is actually ground zero for America's water crisis. Currently in the United States, about 1.6 million people do not have access to hot or cold running water, a bathtub or a shower, or a working flushing toilet. And so about 40% of the people in the Navajo Nation do not have access to any of those things. And so do check out Dig Deep. We're going to have the links in the description. Colgate has come out with a new recyclable toothpaste tube. Previously, toothpaste tubes are actually historically hard to recycle. You've got all this gunk that stays in there. How do you get that out? It's not actually a simple process. And so Colgate and a whole bunch of other companies have formed a consortium called Loop. And you can check out our article and our show links to Fast Company's coverage of this. But Loop has other companies like Haagen-Dazs, Crest Mouthwash, Tide Detergent, Procter & Gamble. And what they've done is they've created a platform where they share ideas to make their products fully recyclable, to where, let's say, you've finished using a couple tubes of toothpaste. You can send it back to Colgate or one of these other companies, and they'll send you back the product sort of refreshed, reloaded. So that way you're not throwing the container away every single time. So again, check it out. The consortium's called Loop, and there's fantastic coverage by Fast Company you can check out. Country Time Lemonade through Country Time Legal Aid has paid for lemonade stand fines. So in Alabama, and this coverage comes from WHNT 19, a local news network in Alabama. The Alabama Department of Public Health, when interviewed, one of their officials was interviewed. Their environmental supervisor, Cheryl Clay, was interviewed. And they said that if they find kids running a sort of pop-up lemonade stand, they will shut it down. And they possibly will fine you. And I'm going to quote the public health supervisor, Cheryl Clay. If someone makes us aware of it, we would investigate and go to the location and explain the requirements of the law to the individuals, or probably their parents. She goes on to say, you're handling an unpackaged food, being the lemons, ice, things like that. Hand hygiene does come into play. Improper hand hygiene is a big contributor to foodborne illness outbreaks, that is, says Clay. All right. Well, are we that afraid of, kids touching lemonades and everyone getting sick? there are reports in New York City that there was like a 45% jump in the reports of bed bugs, and that's in swanky hotels too. You know, the St. Regis is not immune to a couple of infestations, so that we actually have to go out and shut down and fine and sue kids and their parents is terrible. And so that's why Country Time Lemonade, you know, probably in an effort to sell some more lemonade mix, because that's their business, they've set up Country Time Legal Aid. And they are helping the parents of these kids pay for their permitting fines, sometimes full-on lawsuits. There were lawsuits up to $60,000 in legal expenses that were covered, or the legal aid team just did the work pro bono. And so currently, only 15 states allow lemonade stands, which is kind of ridiculous. And the other thing that's crazy is that the public health official actually went on camera to say, we'll shut you down. Don't start a lemonade stand. All right. Well, we've got our special guest coming up, Kristin Karas from Dance Safe. Kristin is the director of operation at Dance Safe, and so she contributes to the strategic planning, project management, you know, the chapter development, their programs. She does a whole bunch of things for Dance Safe. And so during her time at Dance Safe, Kristin has provided many services for people, particularly at national events like Tomorrow World, Lightning in a Bottle, Imagine Music Festival, EDC Las Vegas, and the Global Eclipse Gathering. And on top of her work with Dance Safe, Kristin has also worked with a number of drug policy and harm reduction organizations in her local community in the Denver area. She also serves on the board of the International Drug Checking Day. And so at the end of the day, the reason we've got Kristin on is that she's passionate about ending the war on drugs and making the world safer. All right, Kristin, thank you for being on. Can you hear me?
Yes, I can.
Perfect. So thanks for being on. And why don't you go ahead and just introduce yourself to us, how you got involved with Dance Safe, what you do at Dance Safe, you know, introduce us to the organization.
Yeah, absolutely. So first I'll introduce Dance Safe. I think that'll provide more context for how I got involved. So Dance Safe is a 501c3 public health nonprofit that promotes health and safety within the electronic music and nightlife communities. We are a chapter-based organization, so that means that there are actually 24 independent organizations that we license our name to that carry out our services for us. Our services are provided at music festivals and other nightlife events. You can find our volunteers on the ground at events, either at a table or behind a booth, providing services such as free water coupled with information about heat stroke, free earplugs, information about hearing damage, safer sex tools like external and internal condoms, and factual drug education coupled with drug checking when we're allowed, which I believe we're going to get into drug checking a little bit more later in the episode, so I'll leave it at that. I got involved with Dance Safe in 2014. There was a program called the Visionaries Program that was the support and promotion team of Dance Safe online. I had found Dance Safe because my friends, when I was in college, started dabbling with substances other than your standard cannabis, caffeine, and alcohol. And I had asked them if they just, knew what they were getting into, to which they had told me no. And so I took it upon myself to step into the role of being their peer educator. And through my research online regarding drug education, I had stumbled across Dance Safe, and that was my introduction to the larger drug policy reform movement as a whole. What was you wanted a rundown on Dance Safe and me? There's a third part though.
Well, tell us a little bit. So, Dance Safe runs services in festivals and raves and things like that. And tell us a little bit about the drug checking component.
Yeah, absolutely. So, drug checking is considered to be a public health tool, harm reduction tool, where we are determining some or all of the contents of a particular substance. Right now at DanceSafe, we are currently offering reagent drug checking. So reagent drug checking is a presumptive method of identification. This means that we're able to determine the presence of a substance, but not the purity or potency. We are, though, currently fundraising to be able to purchase a more advanced technology where we'll be able to have a more comprehensive breakdown of all the substances within the sample that is provided to us. Currently, for the reagent drug checking, participants will come to the booth, ask for drug checking services, we'll bring them to a private area, then they will provide between like 1 and 7 pen tip size samples, so like the size of like the ballpoint of a pen tip. And that is when we're able to apply the reagents, which are mixture of sulfuric acid and other and chemicals that are then dropped on to the sample that's provided to us, at which point we are able to observe a color change. These are colorimetric tests. And so, for example, if someone was bringing us MDMA and we were using a marquee reagent, us as a team, we all know that marquee with MDMA would turn a purple color, whereas if it was another substance and it was misrepresented at point of sale, then it very well could be turning another. And that is how we do that with a variety of different substances. With a variety of different reagents, so that we can reduce the risks of false positives and negatives. And that's a quick rundown on how drug checking works.
Got it. So someone could be at an event, and they would go to the DanceSafe booth, if you will, and they can say, okay, I think I've bought MDMA. Can you you would be able to verify if it's at least there?
Yes, and so messaging is really important in what we do. We don't take our job lightly in regards to offering this type of education to the public. And so if we were able to detect the presence of MDMA, we would say this is an MDMA-like substance. We would not say this is MDMA, because to say this is would say this equals MDMA, and there could be other contaminants that we are not that we're not detecting in the substance or in the sample. And so the messaging is super important. We make sure that we walk every single participant through the limitations of reagent drug checking before the service is provided to them, so that they have a clear understanding of what that language is and why we're using it, so that they can use that within their own risk assessment that they engage in after receiving additional information from us.
Got it. And I noticed we looked at the website before we had you on, of course. So we also saw that DanceSafe sells testing kits as well. Now, are those the level that you just talked about, where they can verify if it's there?
Yep, absolutely. And that's why I think that reagent drug checking, honestly, is going to continue to be relevant for the foreseeable future. I definitely would love to see us going in a direction where people are able to have centers where they're able to drop in for more advanced drug checking. But even in countries where that is being offered, there are still some like logistical barriers to overcome, in which case having a reagent drug checking kit, which is something you can be using at home, our fentanyl test strips as well, are things that people are able to purchase online, and they're able to provide drug checking for themselves and their friends and their peers at home, the same that we would offer at festivals at the moment.
Okay, you mentioned fentanyl. Fentanyl's been all over the news, and it's had a really terrible effect on a lot of people. So you mentioned that you have testing strips now. Is that a similar product specifically designed for fentanyl?
No, actually. So these are immunoassay test strips. And because they were initially intended for the use of urinalysis, they are able to detect the metabolites at very small quantities, and which makes them highly effective for detecting fentanyl and its analogs. So there are a variety of different fentanyl test strips that are out there. We specifically purchased from one distributor after conducting some studies with a with a university, we had come to find out that there's some that were just like not as effective. They weren't able to detect nearly as many analogs of fentanyl because it's just not fentanyl that's out there. It's fentanyl and its analogs. And then there's cases where there were some strips that were sold, which unfortunately were just unable to detect anything. So it's definitely important that you're choosing to get your fentanyl test strips from a reliable vendor. And we started carrying those. We've had them for a while now, and they've been wildly popular. People ask them about us all the time, whether they're asking to purchase them or to receive the service in person. And so it's been really encouraging to see the community's like response in choosing to utilize that as an additional tool in their arsenal in terms of taking care of their own health and safety.
Right. And have you been finding that laced with just about everything, or is it more specific drugs?
I would say it's definitely more specific drugs. Primarily, certainly it's widespread within the entire, like within opiates, it's very common. We see a lot of reports regarding fentanyl being found in fake pressed pills, whether that's fake pressed opiates or fake pressed benzodiazepines. That seems to be rather popular. There's also been reports of fentanyl being found in cocaine. So it's definitely being found in other substances other than opiates.
Got it. Got it. So what does checking do for the public as a whole?
Yeah, I think that there's a couple different ways in which drug checking is useful. First and foremost, I mean, on the individual level, we see that participants who engage in drug checking, first and foremost, they're going to have more information about the substance that they're potentially intending on consuming. But in the circumstances where someone brings us a substance that they were not that it wasn't what it was supposed to be, as in it was misrepresented. So, for example, in the event that someone was looking to partake in MDMA, but upon drug checking services being provided, they find out that it is like an ethylpentalone or another cathinone. In many cases, folks will choose to discard the substance. In a study that was conducted surrounding this very issue with Johns Hopkins, with data of ours from I think like 2013, 2015, in that range, had found like up to, I think it was like over 70% of participants who got unexpected results chose to discard their substances or chose not to partake. And so we are definitely finding that there's evidence to suggest that the information provided to folks is in fact changing their health behavior. In the case of fentanyl test strips, I know there was also a study that was conducted by Brown University where folks were also not only engaging in the disposal of substance, but in the event they still chose to consume, they were doing things like in the event that fentanyl was detected in a supply that they were intending on consuming, they would do other health behavior modifications to reduce their risks, whether that was having naloxone on hand, having a friend present, and other interventions. So that's very promising. It's also, I think, useful for us to have, depends on us, but it's definitely useful for us to have a better idea of what the overall drug supply is looking like, because that can better inform our services. So yeah, at the end of the day, I think drug checking is a really important public health tool when you're talking about, especially when you're starting to talk about, in the case of fentanyl test strips, where I think some of the behaviors may be more likely to be leading to overdose. It is like a way for people to be mitigating risks, and that means we're helping prevent adverse medical incidences and even deaths.
Right. It's not a market where you can get the label that says certified on it or anything like that. So in this case,
Yeah,
it's sort of like the truth will
absolutely.
set you free, and information is key. Now, for those
Yeah,
people,
absolutely.
for the people that are watching, that might be wary about really engaging with drugs in any form, they might ask the question: doesn't testing or checking encourage the use of drugs?
Yeah, absolutely. I think that a lot of folks who initially get introduced to just harm reduction in general, any practice of harm reduction, there's fear that by talking about it, we are somehow inherently condoning it. But I really do think that when you start looking at what always has been implemented, I think the much better question is, like, can you show a case where not providing this type of information has saved a life? Because at the end of the day, like, humans are going to continuously to engage in risky health behaviors. I would also play devil's advocate in what some of your viewers' views might be of drugs. Like, are they consuming alcohol? Are they consuming caffeine? Those are regulated drugs that we have access to, and therefore there's a very much different culture around them and understanding of them and like practices that are out there as well. So I think that's something worth keeping in mind. But at the end of the day, like, harm reduction is all about meeting people where they're at. And these folks have already made the choice to engage in this behavior. And so instead of telling them just not to, the whole Just Say No campaign that, was really driven by the DARE program was really ineffective. And in a lot of cases, also resulted in a lot of mistrust. If you're like spreading what are lies and not facts about these different substances, and then people start talking to other individuals and friends and peers that have like tried LSD or tried mushrooms or tried cocaine or some other substance, and they didn't have a bad time and they actually had a good time because people engage in drugs because they're fun. Like, then there's going to be a huge issue because they're going to be like, well, in this lived experience, like, these people have engaged in these behaviors and all the terrible things that I was ever told would happen to them hasn't happened. And so then that results in mistrust. And then when you really are trying to convey a message that is really important and like that something is in fact truly risky and requires like that much more thought, it could very well fall on deaf ears. So I think it's very much a disservice, especially to youth, to not be providing this type of information to them.
That's a fascinating point. And I want to ask you my last question. What else can people and organizations do to participate in the harm reduction movement?
Oh, goodness. There's so many different opportunities. No matter where you are, if for some reason, you're interested in getting involved in different harm reduction efforts, I would suggest looking into seeing if you have a local harm reduction center, agency, coalition. There's plenty of different opportunities to get involved with syringe access programs out there, and naloxone distribution. Of course, I'm going to suggest that you can get involved with DanceSafe. If you go to dancesafe.org, you can go to our Get Involved tab, at which you can follow a link to our online volunteer training. So anyone, no matter where you are in the United States, you're able to access our online training. And if you live near a DanceSafe chapter, we'll place you with them. And if not, we can talk to you about starting one in your local community. If you are interested in making a difference, but have like lower capacity and like have time constraints, like, of course, be considering giving these different organizations donations. There's plenty of folks who are registered nonprofits like DanceSafe. We're a 501c3, and donations to us are tax deductible. And then something else that I think a lot of people don't always consider is you don't always necessarily need to get formally involved in an organization to start making a difference, because a lot of this is related to kind of just like re-educating and putting education like back out there for people to have a better understanding of these topics. And it goes a long way to have a conversation with your friends and your peers, because at the end of the day, like, at least for DanceSafe, we're based off of peer-to-peer education because it's so effective. Like, people that have like shared life experience, background, etc., are going to be able to feel like they can identify with the person delivering the information. so much better. And so talk to your friends and talk to your peers. And if you see that there's like legislation up that can open up access to these services, like make sure that you're calling your representatives and, emailing folks to let it know that you support these evidence-based efforts.
Fantastic. Well, thank you so much for being on, Kristin. That was all the time we had. Again, everyone, you can find Kristin Karas at dancesafe.org. She's the Director of Operations. Thank you so much for being on, and we'll talk to you later.
Yes. Good night.
Well, what did you think of the interview? Do you think that drug checking is a good way to prevent overdose deaths? Put a comment down below. We'd like to hear from you. And we'll be mentioning any comments next week on the show. Now, I want to get into an article by Topher Spiro of the Center for American Progress, because he has an interesting proposal for an interesting problem. First, I want to get into some of the facts. So, Topher Spiro is the Senior Fellow and Vice President for the Health Policy at the Center for American Progress. And he goes on to, in his article, last month, 43 states and Puerto Rico sued prescription drug companies. Remember, we were just talking about illegal drugs. Now we're talking about prescription drugs. Prescription drug companies for inflating prices by up to 1,000% from 2013 to 2015. And in those inflated drugs include generics as well. And from 2012 to 2016, the average price of insulin nearly doubled. Okay? And according to a Politico survey, about 80% of Americans think that drug prices are a major issue. And Politico also found that Congress, when polled, was quite divided on how to handle the issue. Now, those are the facts. And Mr. Spiro points them out really, really well. Now, I want to get into what his proposal is, because that's the key thing here. He says, there's a simple solution for lowering prices of both old and new drugs for all Americans, not just for seniors under Medicare. A windfall profits tax that takes back surplus profits derived from excessive prices. This tax would be equal to the difference between a drug's list price, the price that is used for patient payments, and the drug's justified price multiplied by the number of units sold. Now, Mr. Spiro is not the first to make a case to create a windfall tax or some kind of additional tax on drug companies or this scenario. Regardless, I'm going to address his argument and how it fails to address the underlying economics of the situation. Now, I'm going to go on and give you a little bit more context from the article. He writes that he proposes that the Institute of Drug Assessment within the National Institutes of Health would assess the values of the drugs. So essentially that a government body would assess the value of the drugs. They would create an assessment, a formal assessment using a variety of factors, and I quote, such as demographic subgroups, the disease burden, the effect of the drug, health inequity, affordability, and so on. And he says, drug companies are to be required to submit to the Institute a dossier of clinical evidence that speaks to the drug's benefits and risks. Okay. And he says that then the government and these companies would come to an agreement, or if they couldn't, that the government would simply set the price for them. And then this would be done through the Department of Health and Human Services. And the idea being that if we create this new body or expand the existing body within the government that handles this, then somehow we'll get the prices to work. Now, there's a few points that I want to address here. First is that he's assuming that monopolies, because what he's saying is that the drug companies have created this oligarchy, this monopoly, there's very few players, etc. Well, regulated industries tend to have fewer and fewer players over time as regulation is increased. A great example of this are utilities and private utilities. Utility companies phone providers, telecom companies, they're notorious for having bad customer service. The prices seem to stay the same all the time. It's because there's usually only one or two providers in the area. And this is set up through the local government only issuing permits to one organization. Compare this to the TV industry, the cell phone industry, your laptops. Prices have gone way down. Power has gone way up on your cell phone. If you've got an iPhone, you've got fantastic camera quality that you couldn't get out of an expensive Kodak or Canon years ago. Now, I also want to point out that these regulations also create the leviathans that Mr. Spiro talks about because, and I've got a link to a Forbes article from 2015 by Nicole Fisher. The literature says that it costs an average of $2.5 billion to get a novel drug to market. $2.5 million to get a drug to market. And very few products ever hit blockbuster status, meaning about $1 billion in sales. And that wouldn't even be breaking even, right? You have to spend $2.5 billion to have $1 billion in sales. The math does not work. And in 2015, she cites a very large merger, a $15.8 billion deal for Salix Pharmaceuticals. It came to an end as Valiant Pharmaceuticals beat Endo International with an all-cash offer for Salix Pharmaceuticals. And so you see merger after merger because it takes too much. You have to go through too many hoops. You have the patent laws. You have FDA approvals. You have testing and study requirements. You have federal, state, local codes, medical licensing. You've got thousands of pages of laws that you have to get through to get a drug out into the market. And so what Mr. Spiro's proposal would do would only create another layer of bureaucracy that a potential competitor would have to go through to actually get a drug to market. Maybe instead of it costing $2.5 billion, now it's going to cost $2.6 because you've got to figure out how to get around that rule. And there's also the assumption that drug companies and politicians are clean, that they're moral, respectable, straight-shooting people. Well, look, there's a report from Kaiser Health News. In January 2018, 340 congressional staffers were ex-Big Pharma employees. The Secretary of Health and Human Services under Donald Trump is ex-Eli Lilly. He was an ex-executive for one of the biggest producers of insulin in the United States, and now he's the Director of Health and Human Services. Sorry, the Secretary. It's a revolving door. Are you going to trust that revolving door? And last, I'll add that there are solutions that we can find. Check out our old episodes with Charles Frohman. I think it was We Do Better number 4. You can sign up for a health sharing company and start buying drugs from foreign countries like India. India has different patent laws from us, and so they can produce all the generics they want, and their drugs are at a fraction of the cost. Why don't you buy their drugs there? You can also check out the Physicians Committee for Responsible Medicine. They talk about how to get healthy with a whole food plant-based diet. Those links are in the show notes. Go to labdoor.com. They work in the supplement industry, which is basically an unregulated field. How do you know your supplements are any good? Well, Labdoor does the testing to make sure that the supplements you buy are top notch. All right, well, thank you so much for listening. Again, my name is Rick Rifkin, coming to you live from Austin, Texas. We're going to be on every Wednesday at 7 p.m. Eastern Time. Again, We Do Better News is brought to you by We Do Better. We're a grassroots organization. I'm a volunteer. Support the show. Go to wedobetter.org/donate. And when you go to wedobetter.org, read up about us, get involved, and thank you again so much for listening.